Hello, I am Dr. Khalilah Jefferson, DNP. Today, I would like to explore, after the storm, how nurse practitioners rebuild confidence and resilience. In my previous talk, we discussed something every healthcare provider eventually faces, an outcome that doesn't go the way we hoped, a complication, a difficult case, a moment that stays with you longer than you expected. But today, I want to talk about what happens after that moment. Because the real challenge for many nurse practitioners isn't just the complication itself, it is what comes next. The chart reviews, the hallway conversations, the second guessing, sometimes even public or professional scrutiny. And somewhere in the middle of all of that, a quiet question appears. Can I still trust my clinical judgment? For many clinicians, this is the moment confidence begins to fracture, not because they lack skill, not because they lack training, but because healthcare can sometimes turn one difficult outcome into a question about an entire career. Yet the truth is this: every experienced clinician has faced moments like this. The difference between those who burn out and those who grow often comes down to how they recover. Resilience in healthcare isn't about pretending difficult outcomes don't affect us. It's about learning how to process them in a way that strengthens our practice rather than shrinking it. And that recovery often happens in three phases. First, reclaiming the narrative. When complications occur, the story can quickly become simplified. Something went wrong. But clinical reality is rarely that simple. Recovery starts with returning to the full picture. What information did you have at the time? What evidence supported the decision? What was done correctly? Understanding the case with clarity, not emotion, helps restore professional perspective. Second, transforming scrutiny into learning. No clinician enjoys being questioned, but structured review, when done well, can be one of the most powerful tools for growth. Not every question is an accusation. Sometimes it's an opportunity to refine technique, communication, or systems of care. The goal is not to defend every decision perfectly. The goal is to leave the experience a better clinician than when you entered it. And third, rebuilding confidence through action. Confidence rarely returns through reassurance alone. It returns through continued practice, through learning, through showing up again for the next patient. Healthcare careers are built over thousands of decisions, not defined by a single one. Each new patient encounter becomes a small step in rebuilding trust in your clinical instincts. And something remarkable often happens. Clinicians who have faced difficult scrutiny often become the most thoughtful providers in the room. They ask deeper questions. They communicate more clearly. They approach risk with both humility and wisdom. In other words, they become better clinicians because of the challenge, not in spite of it. So, if you are a nurse practitioner who has experienced a difficult outcome or felt the weight of professional scrutiny, remember this: your career is not defined by a single moment. It is defined by your willingness to learn, adapt, and keep showing up for your patients. Because the goal of healthcare was never perfection. The goal is continuous growth in service of better care. And sometimes the most resilient clinicians are the ones who have already weathered the storm. Thank you.